Good afternoon, everyone. Thanks for joining us today for this super important conversation. I'm always very excited when I get my friend Radha and ECEC on our wavelength, and we ask them, and they always very generously share the work that they're doing on behalf of us all in Washington and in your state. So really excited about this conversation. I'm so excited to bring my friend Radha Mohan in with me today. Radha is such a strong supporter of our industry. And my favorite Radha story is that in the early days of COVID, when we were all shutting down and no one knew how to navigate, I reached out to KinderCare's CEO at the time, and he immediately connected me with Radha on a Saturday afternoon with a toddler in the background. Radha took her time to talk to me about what they thought was happening in Washington and in our states, and it was such invaluable information to pass along to you guys and to help navigate that crisis situation. And the work that they do on behalf of all of us is incredible. So thank you for joining, Radha. And I would love for you to tell our guest about yourself and about ECEC and the work that you guys do. And then I have so much to talk about today.
Thank you so much, Kathy. And as always, thank you so much for having me on. Always appreciate the work that you and your team do. For those of you who do not know me, I'm Radha Mohan, and I serve as Executive Director for the Early Care and Education Consortium. ECEC is a trade association for high-quality, multi-site childcare providers nationwide, as well as service providers and affiliate memberships for state associations as well. What we're really here to do is ensure that early education providers are represented at every table where there are relevant policy discussions taking place that involve stakeholders and issues that affect us. So anything that affects providers, teachers, early educators, and the families that they serve are the issues that we care about. That includes everything from funding for childcare to some of the regulatory guidance that comes out that really determines how you can run your programs. Too often, I think providers are not at the table, and our aim is really to correct that. And I want to thank Kathy and her team again for giving us this platform to make folks aware of some of the work that we do.
Yeah, thank you so much for that. And really, it's because of you guys and the work that you do that even allows us in that door. So thank you for that. Reminder to you guys that I have so many things I want to speak with Radha about, but also we would like for you guys to contribute your thoughts and questions. You can do that through the chat or the Q&A that you'll find over to the right of your screen. I will try to monitor that as we go, and also we have time set aside at the end to get your thoughts and questions about where you are, what you're experiencing, and what you're concerned about, because that's great information for both of us. So please engage with us that way. We'd love for this to be a conversation. So Radha, I would love to start with One Big Beautiful Bill, the One Big Beautiful Bill Act that Congress recently passed. There were several important provisions related to childcare. Could you give us an overview of those and how you see those benefiting families and also early childhood educators?
Absolutely, Kathy. So there are really three main tax provisions that improve childcare tax credits in the One Big Beautiful Bill, and that's where I want to focus for a second. If you read the media narrative on these, they are mixed. Everything from, they don't do enough, all the way to, really celebrating this as a major victory. And I think what I'd like to highlight is many of these credits weren't updated for 30 years, which basically means that since these credits have been enacted, despite all the changes that have taken place, despite the pandemic, despite all of these things, credits remained at the same, percentage value or the same dollar value that they were in the 80s and 90s. So just a quick overview for the credits. Really want folks to think about these as practical tools that you can leverage in your outreach to families and businesses. More funding and credits reaching families means greater affordability and financial stability. We hope that some of these things, while they're not huge dollar amounts, if you look at some of these things in combination or at the high end, it could mean up to a month and a half of free childcare for a family, for a middle income family. The three credits are the Child Independent Care Tax Credit, which is a direct credit for families to reduce taxes for childcare expenses. Lower income families can now claim up to 50% of childcare expenses, up from 35%. And middle income families get significant increases too. In fact, middle income families are likely going to see the biggest increase on what the One Big Beautiful Bill Act does. The second credit is the Dependent Care Assistance Program. Employers who offer we call them DCAP accounts, can now allow employees to set aside up to $7,500 pre-tax, up from $5,000. So this means that working parents with benefits can get better coverage on their childcare costs, which again, we hope that you will we hope you'll share with employers, we hope you'll share with families so that they know to ask about some of these benefits. The last tax credit that was enacted as part of the One Big Beautiful Bill Act was the Employed Child Care Tax Credit. Now, this credit isn't widely understood, but under prior law, businesses could get a maximum of $150,000, which, as we all know, if you're building an on-site facility, is next to nothing. And even if you're doing contract childcare, unless you only have to do contract childcare for a few employees, $150,000 cap was impractical. That cap has now increased to $600,000, and essentially for a small business, you can now get up to 50% of your qualified expenditures reimbursed through the Section 45F tax credit. As a reminder, this is for both on-site facility childcare and then also, for contract-based childcare. So if there's a small business in your area and they're looking to do something for their employees, they can get up to 50% of those costs reimbursed by the federal government through a tax credit. So we really hope that this will be a driver for small businesses, but I think there's a huge role for providers to play in all of this and make sure that businesses and families are educated about what was included in the bill. Apart from the three child care tax credits, there's one other thing that I wanted to touch on, and that's no tax on overtime. This specifically benefits early educators. So, if you have an early educator, up to $12,500 a year for individuals, $25,000 for joint filers can be deducted from taxable income to the extent that it is considered overtime pay. The benefit starts phasing out at $150,000 for single filers or $300,000 for joint filers. So this should really be able to benefit your teachers, your center directors, and some of your other staff that have overtime pay.
Yeah, fantastic. It sounds like our main opportunity with the tax credits are educational in nature because they will apply to either our parents, small businesses in the area whose employees might come to us for childcare, or our teachers related to their overtime. So, which obviously, if people feel less of a financial strain, could easily lead to increased enrollment and increased participation in a school that they felt like was out of reach financially. But is that a good way to think about it?
Yes, that's
Right.
exactly right.
Okay. Perhaps we could work together to put together a bullet list of teaching points, and then we could distribute that to this group. So you guys let us know if that sounds like something that would be useful for you. But that's really good. So I was not aware of all of those the points in the bill. So thank you for that. Further, I'm thinking about the government funding deadline that's approaching at the end of September. And what are your predictions and expectations for child development block grant funding this year? I know that we all closely watch our three main funding streams: Child Development Block Grant, USDA Food Program, and Head Start, mainly to a lesser degree because Head Start collaborations are sometimes prevalent in our community. But what specifically do you think we might see for Child Development Block Grant funds?
Sure. CCDBG, as you stated, Kathy, is incredibly important. It's a foundational funding source for childcare subsidies, helps low and moderate and low income families access care. And the level of funding set by Congress essentially affects providers' abilities or states' abilities to increase the reimbursement rates, to increase the number of children served through subsidies, which ultimately is determinative of whether an individual center is able to serve subsidy families as well. Several years ago, we set out on a path to double CCDBG over 5 years. This was a goal for Susan Collins, who is now the chairwoman of the Senate Appropriations Committee. Fiscal year continuing resolution deadline is approaching on September 30th, which essentially means that Congress, House, Senate have little over 6 weeks to either reach a funding deal or to do another continuing resolution again. The good news is on the Senate side, they have proposed $8.8 billion in funding for CCDBG, which is about $85 million above last year. It's a modest but incredibly helpful increase, especially at a time when so many other education programs are being slashed. The House has not gone through its, we call it a markup, but that's essentially the procedure that they're going to go through to determine what the funding increases, if any, will be for programs in the labor HHS space, which is where CCDBG falls. That markup is currently slated for September 4th and 5th. So we're encouraging folks to reach out to House appropriators and just highlight what the Senate did and ask for a modest increase. Last year, while most programs were being slashed, the House actually proposed a very modest increase to CCDBG, which in the context of the House is phenomenal news. So our messaging is working. We just need to stay the course and make sure folks understand how helpful this is in their state.
Yeah, thank you for bringing that up. It's so difficult to and so necessary to get involved to the extent that we need to in the industry. So I'll maybe save that for the end, some practical ways to get engaged if you don't have a strong early education group in your state that might be doing that on your behalf. But so we've all been watching the current administration with great interest, obviously, and we wonder what position will be on early education What new initiatives do you think we can expect from the current administration, particularly from Department of Health and Human Services and the Administration for Children and Families? What do you expect to see there?
So it's interesting, the Biden administration, towards the end of the Biden administration, they proposed a final rule on the Childcare and Development Fund, so CCDF, which made many important updates to the regulatory guidance. It allowed for payment based on enrollment versus attendance. It allowed for prospective payments. It simplified applications. It limited family co-payments to 7%. It was really one of the more comprehensive updates to CCDF that we've seen in a while. The current administration is reviewing that rule, and it is unclear if it's going to be repealed in its entirety or whether they're going to keep pieces of it and eliminate other pieces of it. Recently, and the reason why we're concerned about the deregulatory approach is in a request for information issued by HHS this past May, the RFI essentially requested information on how to deregulate across all areas that the department touches, as well as submissions explaining how regulations, guidance, paperwork requirements could be repealed. So this approach really aligns with the administration's broader goals of reducing regulatory burdens and increasing transparency. The comment period closed on July 14th. Our push on this front was really to focus on keeping pieces of the Biden regulatory guidance, pointing to the fact that some of the things that the administration did have actually long been bipartisan priorities and resulted in simplification for businesses, greater transparency for families. We were, from conversations that we've had with folks in the administration prior to them putting out the request for comment, it seemed like they were very open to taking suggestions from stakeholders into consideration. So we are hopeful that we won't see a full repeal, but instead it may be a little bit more of a piecemeal repeal and a more thoughtful approach to how they're going to address those CCDF regulations. So stay tuned on that front. We don't have more information, but we'll find out in the coming months.
Yeah, a couple of thoughts about that. Our, in my opinion, greatest challenged community are those that predominantly serve the subsidy care market. And there was such excitement when we felt like that we could get paid on enrollment, not attendance. Our expenses are there regardless. That co-pays would be limited, although it wasn't clear, unless you correct me, who was going to fund that difference. Was it going to be the school, or was it going to be the government? So that was a whole, I think. And I think, am I correct that states currently have 2 years to comply? Okay.
They do. And most states have requested waivers. Technically, the regulatory guidance mandated that states be the ones to cover the difference. From a practical standpoint, we had major concerns about whether that would actually happen. Most states deferred and asked for a waiver, which again, most of them received. So it remains to be seen how implementation will shake out and whether implementation will even take place.
Okay. Yeah, really interesting. Again, we get a lot of questions around this. And are some states that I understand complied immediately? We're a year in now, I think, right? Are we a year in now? And the majority either like you said, have asked for a waiver. Does a waiver mean we get to delay or we get to not comply?
A waiver means that you get to delay, not that you don't get to, you still do have to eventually comply. It's just a question of whether the regulatory guidance remains on the books. Now, a lot of states took some action to, change some of the requirements around enrollment versus attendance. The issue is, for a lot of states, the number of dates that you can, or the number of days rather, that you can miss is just ridiculously low when you've got young children. Anyone that survived a winter with young children know that, there are just so many days that they're sick. They've got colds, whatever it is. So that's really the crux of the issue. How are states going to interpret this? Are they going to move forward? Will the feds remove the requirement? And if they do, will states actually still move forward or keep the progress that we've made on the books?
Yeah, that leads me to another question I'm jotting down for later. Hopefully we have time for. Let me go back to where I wanted to be sure that we got started. So the administration recently issued an executive order on DEI, the diversity, equity, and inclusion, and related to the Child Development Block Grant. Could you talk to us about how you look at that and the potential impact on our childcare programs and what that might mean for the way we operate and what we might see there?
Sure. So I want to note, so in early July, Kathy, as you stated, ACF sent it's called a secretarial directive to all state CCDF administrators, encouraging all recipients of CCDBG funding to review their plans, services, expenditures under the programs to ensure that they don't support DEI initiatives. This shouldn't come as a shock to anyone. The directive is very much in line with the administration's priorities and earlier executive orders to limit DEI initiatives from early education all the way through higher education. Now, the language in the directive should be interpreted more as a warning rather than an order that has specific direct consequences for CCDF program recipients. So, for example, throughout the directive, recipients are strongly encouraged to review all materials, budgets, programs, goals to ensure that they don't support DEI. There are no specific consequences listed in it, unlike higher education where it was contingent on Title IV funding. It doesn't say that if participants do not participate, then they can no longer serve CCDBG families. You could be subject to enforcement action if it finds that your expenditures do not comply with federal law, which does potentially mean a pause or revocation of funds. It is really difficult to predict how the orders are going to play out across states. There are a lot of remaining questions about the feasibility of the order. It would require monitoring at the state level, at the individual provider level, to ensure that CCDBG funding isn't being used on DEI initiatives. Also, CCDBG, unless you are only a CCDBG program, most providers have blended funding as well. So it's a very murky EO. Our advice to folks is review your programs and make sure that there isn't anything in there that would overtly get you into trouble. The biggest potential way for a provider to potentially get into trouble is if a parent reported you or a teacher for something. Those are the types of things that could get picked up. It is when you work with families, when you work in a client, when you work in an industry that is outward facing and you are dealing with families and you're dealing with people, there's always a risk. So I think a common sense approach at this stage is what we're recommending to folks.
Yeah, okay, really interesting. I have a little confusion about what might be interpreted as a common sense approach. It will be interesting to see the things that schools have lived with and integrated into their companies and into the classroom, how those things are viewed, that they feel now like commonplace conversations and educational aspects of their program, but we don't know yet how that might be interpreted. But, you know, I don't want to send up a panic flare. Yeah.
No, I think some of this is, if you look at this within the context of higher education, they're not going after schools for celebrating Black History Month. They are going after schools if you've got race-based admissions, if you have spaces where certain, you know, groups or certain folks of certain ethnicities are excluded.
Okay.
They're looking, you know, so if you have clubs that are exclusive to one ethnicity or to a race or whatever the binding factor is for the group, but you don't allow other folks to participate, that's when schools are getting into trouble. Mm-hmm. So again, it's hard to predict exactly where something like this would go. If folks are concerned, we recommend having programs that are rather conversations that are tailored to your individual program, so that, you know, whoever you're talking to should have an understanding of the broader context of how you operate when right. Giving you advice.
And mainly we're talking about outward facing programs, or it being known that certain groups are preferred or not preferred, or that's the kind of thing we need to think about, not actually what's being taught to children or down to curriculum levels.
No, sorry, that was in the context of higher ed. Down with early education, there certainly there could be scrutiny on your curriculum, right? So, yeah. You know, there are certainly concerns about that. I know that some of the accreditation orgs are definitely concerned about that. It's just unclear how they're ultimately going to wind up enforcing this and monitoring this.
Right. Okay. All right. Interesting. A new thought that I didn't actually have. Can we talk a little bit more about Head Start? So we mentioned that Head Start was one of our private education community's main funding streams, although it's the third in order. We have seen an increase of collaborations with Head Start, and some of those classrooms being provided in private childcare situations or mainstreaming students in their school. What do you see about, what is the latest and updates and about the status of Head Start, and where do you feel like policy might go?
So it's interesting. Head Start still remains a very bipartisan program, and we are hopeful that the program will not face significant cuts in the upcoming appropriations process, despite pressure from OMB Director Russ Vaught, who has historically expressed an interest in cutting Head Start funding. The OMB early budget that leaked earlier this year zeroed out funding for Head Start. However, the Senate Labor HHS Committee has proposed an increase of $85 million for Head Start as well. The House is absolutely not expected to propose as large of an increase, but the House is also not likely to zero out the program either. So a little bit of good news that the administration's position on Head Start is not Congress's position on Head Start, and ultimately Congress controls the appropriations process. how, despite all of this, despite OMB's position on Head Start, ACF, the Administration for Children and Families, did recently announce the availability of one-time funding for Head Start grant recipients to invest in nutrition as part of the Make America Healthy Again agenda. That's the MAHA agenda. And then for those who do have Head Start programs, there is a Government Accountability Office, a GAO report that recently discusses some of the funding that was withheld between January 20th and April 15th. They noted that the withholding the funding was a violation of it violates something known as the Impoundment Control Act. For your purposes, it is a violation of law. And ultimately, the disbursements were made. So to the extent that you do have a program or you were affected by any of this, there's a great GAO report out there, and we're happy to pass that on to you, Kathy, so that folks on the webinar who are interested can review it.
Yeah, that would be great. Also, in the one-time nutrition funding, is that available to current recipients of Head Start funding?
Yes.
Yes. Okay. Where can people go to find out about that?
There's an announcement page on the ACF website, which should give you a lot more information on how Head Start grant recipients can actually avail themselves of the program or apply for a grant under the MAHA program.
Okay. Sorry, I see a couple of people are having an issue with our connectivity. Sorry about that, guys. If you're having an issue, we're going to send the recording out. Apologize for that. It is on our end. You guys pop in the chat or the Q&A if you have any collaboration with Head Start, how that's working for you, and if you're aware of this one-time nutrition funding. So let's flip over to some things that are going well, because I have been really excited about some of the state initiatives that have happened in, I guess I try to think how long things have been, 2 years maybe since the majority of the federal funding ran out, and then we really started to look at to states to support our community. Can you talk about some of the strategies that you really like? What are some of the most promising strategies, and those that we might use as models for other states? So we regularly hear people talk about that it's a successful conversation with their own state legislators if another state has already done it and it's going well. So models of successful programs are very often great conversation starters. Are there some initiatives that you really like on the state level?
Absolutely. And, states are, especially in this area, states are laboratories of innovation for this industry. It's often a state that does something before the federal government moves forward and tries to adopt the policy on a broader scale. So state policy is incredibly important. And a major focus for ECE. We do work in about 14 plus states now, and I would be remiss if I didn't call out, some of you may have interacted with our two directors of state government relations, Elsa Jacobson and Kathleen McHenry, and they drive really a lot of this work that we do forward. Kentucky is the one example that I want to give. They essentially made childcare staff automatically eligible for expanded eligibility under the childcare assistance program. So essentially, if you have staff that work 20 hours a week, then they're automatically eligible for childcare benefits under the CCAP program in Kentucky. This is incredibly important because if childcare is $20,000, $25,000, or even if it's less than that in your particular state or program, this is a fantastic benefit because it basically means that they're going in for free. There's no copayment, there's nothing. So I think that piece of it is really great. Other states like Arizona, Georgia, Illinois, Iowa, Massachusetts, and Rhode Island also have similar support programs for early educators. Illinois recently lowered its copay to $1 for the CCAP program for eligible families, or eligible families that had working parents. Texas more recently, if you need another example of it, did something like this, prioritizing childcare staff for subsidy, enabling them to either skip or just move entirely off the wait list as well, which means that they don't have to leave your classrooms because they're having trouble with childcare. They know their child is safe and being cared for in a high quality program. So that is number one on our list, especially because of the early educator impact on that front. The other thing that we really like and have been pushing for are property tax abatements to all to all childcare centers. States have done different versions of this. They often need to find some sort of a limiting factor. So Florida's legislature did the tax abatement for all nationally accredited childcare centers. Previously the abatement was only available to childcare centers that actually owned their property. We wanted to see that expanded. So the expansion that they acquiesced to in the state legislature was that if you were nationally accredited, then you could avail yourself of the property tax abatement. This is expected to save childcare providers more than $5 million each year in Florida collectively. So it's not an insignificant sum. And I think it really helps childcare providers put that money towards other operational expenses, running their program, making quality investments, and that sort of thing. So those are the two big policies that we have been pushing for and trying to get more states to replicate. There are countless other examples, but these are some of the things that we found to be effective.
Yeah, you hit my top two as well. So what I really have loved about investing in the childcare of teachers is three things. First of all, excellent recruiting tool. Come to work for me. You don't have to pay for your childcare. You have to pay less, or you might be moved, or at least not on a waiting list and eligible immediately. So easier time recruiting. The teacher who typically pays half, so our industry standard is half is given by the company, half is the teacher pays. So the teacher gets an immediate raise. The third thing is the school no longer discounts that half. So it doesn't sound like it would have a huge financial impact. But when you have 10, 15, sometimes 20 staff children, that converts to 8 to 15 children who are not paying in your school, and that's your whole margin at times. So the financial impact, not to mention the impact on the teacher and recruiting, is just amazing. And also, I did not know that we now saw in Florida that with accreditation, you can get property tax abatement if you pay it, even though you don't own the property. So that has never made sense to me. You know, your lease requires that you pay the property taxes, and only people that own their property get property tax abatement. So thank you for that. But I really do also love those two. I feel like they have been integrated enough for providers to look to those states as examples of success and take that message back to their own state. So, so thank you for that. I love those two as well. What about on the state level? I'll go the other direction. Do you see any concerning trends or challenges on the state level that we should be aware of?
Yes. I think a couple of different things that I want to mention. First is deregulation. There is sensible deregulation, and then there is deregulation that's actually harmful for children and families. And we never, at least as an organization, we've tried not to support the second type of deregulation. I'll give you an example. Most recently, Idaho proposed eliminating state-mandated childcare staff ratios for licensed programs, which would essentially allow providers to set their own ratio policies. Now, again, we do believe that by and large, people are responsible and don't ever want to see something bad happen to a child. But there's also a huge liability that stems from a policy like that, particularly if a program decides that, you know, they can have a 1 to 10 for a very young child. And so things like that we're watching out for. We want to make sure that providers are united in saying that, you know, there are some things that really just don't make sense, because what you're actually encouraging is lower quality, and you're putting those types of centers at a competitive advantage to centers that are doing what is right for children and families versus just thinking about their bottom line. So that's one thing that we're watching out for. In addition to that, we have some concerns about what Florida just did. They're exempting on-site employer-provided childcare from licensure, which we think is a major concern for children and families. We want to make sure that people have basic levels of health and safety. So we don't see the value in doing something like that. Funding shortfalls are definitely something that is always a major concern. A lot of states continue to face very tight budget environments, which, and states have to balance their budget every year, unlike the federal government. So North Carolina, Arizona, Pennsylvania, Minnesota, we saw challenges in a lot of those states this year. Several of those states didn't have a new budget agreement in place at the start of their fiscal year. So that's something that we're definitely something that we're watching out for. On top of that, some of the changes made in the One Big Beautiful Bill Act may negatively impact state budgets as well. We're closely watching Colorado as an example. They have a special session this fall to address potential budget challenges. On the Medicaid side, especially, there are a number of states, up to 33 states, that are expected to see a Medicaid enrollment loss of 12% or more, and then 12 states expecting to see a loss of anywhere between 16 to 26%. So of these states, that basically means that there's going to be a lot of pressure on the state budget to make up the shortfall, to avoid some of the folks either losing access to care. There are a lot of interactions between what the feds did in the One Big Beautiful Bill Act, how that plays out on the state level, and then what that does to the pot of money that states generally have to put towards, healthcare, workforce development programs, childcare, and the rest. So we're definitely watching that very carefully. What the interactions will do to the availability of childcare funding. There are some states like Nevada that already had to really roll back what the percentage eligibility is for families. For a period, they had it set at 85%, but it took a double-digit cut from 85th percentile of median income. So those are some of the things that we're watching very carefully. On the Medicaid front, to the extent that you offer health care to your teachers or they get it through their families, I think they should be fine. For your families, especially your low-income families, this is a space where they could be affected, depending on your family circumstance.
Right. Yeah, a lot to think about there. Yeah, the ratio, there are some isolated cases where ratios or group sizes don't make sense. So that might feel good, but an overall elimination of ratios would be a little scary. What question is a bit related, and then you guys have about 2 more minutes to pop your questions in, because I have one more and I see we have some really good ones. Radha, I've always been curious about, and I assume this is done on the state level, how states set the how they set the tuition reimbursement rate for families. It looks like that they survey the market to see what the market rate is, which is scary to me because the market rate, especially in that family group, will never be the cost of care rate, and a provider almost has to be willing or able to themselves subsidize that family in order to provide high quality care. So is there any conversation about the way that those rates are calculated in a move toward actual cost of care raise? Obviously that serves less families, but maybe makes it easier to provide the quality we want.
Yes. One, I would encourage everyone to fill out that market rate survey. It is so important to fill it out so that, whether you share subsidy or not, we're making sure that market rate is closer to what the actual cost of providing care is. So I cannot emphasize enough the importance of filling out that survey. 2, there are some states, New Mexico being a primary example, that have actually implemented a cost model with a lot of success. In addition to New Mexico, I would look at some of the work that North Carolina and Virginia did recently. Massachusetts is going through a process, if they haven't already gone through the process. I know that California has a working group on this issue, and I'm sure there are more states that I am missing that are having conversations around cost modeling. Simon Workman is an expert on this issue. He used to work for the Center for American Progress, and he's done a tremendous amount of work to educate states about the benefits of cost modeling. So we would definitely say Simon Workman is a great person to talk to, particularly if you're interested in maybe starting this type of a conversation in your state.
Terrific. Yeah, you guys, because I'm going to make another plug for the book. I have a chapter in the book about setting the cost of care rate and how that's different from the market rate, and also how to communicate that to your staff and families. You could also use that to communicate to your legislators in your state, because I really feel like it's more of an education issue. It's a funding issue too, but it always feels to me like it's mainly an education issue. Let's jump over to some questions. I don't want to take up all of the time. Talking points would be great. That's fantastic. We will reach out to you with that. Jamie, one common objection to prioritizing ECE employees is how many there are. Yeah. How many are families? How might that divert funds from other eligible families? How do we overcome that objection? I would say immediately, who's going to serve those eligible families. But anyway, Radha, you probably have a thought on that.
Sorry, Kathy, my audio cut out for a moment. If you don't mind repeating the last piece of that.
Yeah, no problem. Sorry about that. We must be having a global problem. So an objection to prioritizing employees is how many families are eligible. How do we overcome that objection?
Got it. Yes. It isn't an easy one to overcome, but what I would point to is the fact that often early educators are right above that threshold for CCDBG assistance. Two, if you don't have teachers in those classrooms, you can't serve those families anyway. And in so many states, we are facing funding shortfalls not funding. Yes, we are facing funding shortfalls, but what I meant to say is we are facing teacher shortfalls. And as a result of that, you're seeing program closures. So you need qualified teachers in those classrooms. And one way to do that is incentivize them through benefits. If a state isn't willing to do categorical eligibility for childcare providers, you may be able to work out an alternative. Maybe there's a scenario in which there is a copay associated, and maybe the childcare provider is willing to cover that copay as the benefit to the teacher in place of the discount that you previously offered, or in place of the full free seat that you previously offered. So I would explore the possibility of the full provision, categorical eligibility for early educators, but I wouldn't give up if the answer is a no on that. I think there are a lot of creative things we can do. And I think it's incredibly important to just emphasize to legislators that if you don't have those teachers, you can't serve those families anyway.
Right. You know, in the couple of years after COVID, when we heard schools in major trouble or that actually went out of business, it was very often because they couldn't find the teachers to do that. And it seems like this is a segue to our next question. That's been replaced more recently with insurance issues. So any thoughts about tort reform to limit exorbitant increases in auto, bus, and general liability insurance premiums? Big issue in the industry.
Yeah, and this is one that, you know, we've really been thinking about. I don't have a great answer for you on this. I know that some governors have decided to take this on as an issue. Governor, I think, if I'm not mistaken, please don't quote me on this, but if I'm not mistaken, I believe that Georgia's governor at the beginning of the year said that this was on his list of things to address. So I certainly think we are by no means the only industry experiencing some of these problems. We have talked to insurance experts who tell us that some of these issues are widespread. So we would encourage you to speak to your local chambers of commerce, speak to the other business groups that you're involved in. If you're part of larger organizations like the IFA, for those that are franchise-based, please make sure that they're aware that this industry faces these types of issues as well, and that things like this can be a driver of cost as well. And in the worst case scenario, if you can't find coverage, then you cannot exist. So again, it threatens the supply of childcare as well. So I think educating members on that, educating local business groups on that is important. We are just starting to do this work. So I'm happy, Kathy, I'm happy to keep you apprised of our efforts. We want to make sure that lawmakers are starting to understand just how big of an issue this is becoming.
Thank you. Thank you for that offer. A couple more quick things before we end in a few minutes. Oklahoma DHS is counting on the enrollment-based pay not being enforced by the feds. Yeah, I think that's happening in a lot of states. Again, I feel like it's super important to explain that attendance is not the driver of costs and how difficult it is to be paid just when children are in attendance. Someone partners with Head Start, so they're not the grantee, but they're one center along with the ones that are part of a larger grant. Is she eligible for the nutrition grant? Maybe
That is
a grantee.
good question, but I'm not positive what the answer is. I would encourage folks to look at
Yeah. That's a really great question. And it's probably true of everyone in our community that they're a subcontractor or a partner with the Head Start grantee. But really great question. We'll research a bit and see if we can get you a more definitive answer. How did Kentucky plan impact the service levels overall? Was there additional money put in the fund?
Don't know the answer I don't know whether there was additional funding provided, but Jamie, happy to just circle back with some information on how Kentucky handled the funding piece of this.
Yeah, and one more, because we emphasized how important this is in our last couple of seconds. Where do providers access the current market rate survey to be sure?
That's a good question. And again, I can tell you where the final rules are on the ACF page in relation to the market-based survey, but I think it's actually through the individual state that the surveys are collected and run. So I suspect that every state has, through their early childhood education agency, will have access to the survey through their individual state websites. Unfortunately, there's no central repository for all of that. I can provide a link to what an example looks like in a specific state, but each state is just going to have that information in a different place.
Right. Thank you. Thank you for providing that. Thank you so much. I have so much respect for the work that you and your team do on both the federal and the state level. We're excited to have you guys at Shift again. We're very generous of you to come and share your work and your research on the federal and the state level with our guests. So on behalf of this community, thank you very much. You're very kind and generous with your time, and it's greatly appreciated. So thank you. Thank you, all of you, our friends and guests, for joining this important conversation. Stay in touch if there's additional information you need, and we'll do our best to help you access it. So thank you, Radha.
Thank you so much, Kathy, and thank you all for attending.